It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, back again with another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that have helped change people's lives.
And speaking of helping change people's lives, we'll start it off with Dr. Lucien Ravella, one of the best plastic surgeons in the Houston area.
Sharon, she's special in the sense that she was having a hysterectomy in addition to a tummy tuck. So she's, again, had children, had some loose skin, and wanted to have that improved, and had the opportunity to do that at the same time as she was having a hysterectomy.
When I first came to see Dr. Ravella, it was when I was about to have another surgery done. I was going to have a hysterectomy done, and it was something that I was very passionate about. I had tried to lose weight and couldn't get rid of the stomach bulge, so I came to see Dr. Ravella and the staff.
Typically it's someone who's finished their childbearing who will come to us for a tummy tuck. And they might have excess skin that overhangs on the bottom of their tummy area, around the belly button and below. They might have some stretch marks. We remove the excess skin, and then by lifting up that skin, we see your whole rectus muscle, which is the solar plexus. And by pulling those together with suture, it can become firm, like to bounce a quarter off of it.
I was completely impressed with how much caring he has for his patients and the staff has. Everybody was very supportive. Each woman had a different recommendation of what made their life easier or what they've seen patients have an easier time with.
She's now several months out, has lost several sizes, and in addition to the result of the surgery creating an improved body contour, it's actually inspired her to lose more weight on her own, so she looks even better.
I definitely feel like I have had a new lease on life, that I did definitely have a jump start. I feel more confident. This was done completely for me. I didn't do it for anybody else. And in my line of work, that definitely helps to be able to go out and speak confidently to individuals. So it has improved my confidence tremendously.
I decided to come see Dr. Marvin because I struggled with weight my entire life.
Well, Amanda's a fairly young patient. She's in her mid-20s when she had the surgery. She did meet the National Institute of Health criteria for weight loss, which means that her body mass index was 41. She was morbidly obese. She wasn't manifesting too many other medical problems related to her weight yet, but again, she's on the young side, so she had some lower extremity swelling and those kind of things. There's tip-offs that things aren't quite right.
I was very uncomfortable. I was like one of the only heavy people in my group of friends. My husband is very lean and active, so it had a lot to do with our lifestyle, and I wasn't able to go to the pool, and I didn't want to wear sleeveless shirts, or when my friends went out to the club, I didn't want to go to the club. And so it had a lot to do with my age, and I wasn't able to live life.
Amanda's lost from 240 pounds down to 128.5 pounds, and that's a very significant weight loss. That's great. That's a very good outcome for a gastric sleeve.
The recovery for me was pretty simple. I took 2 weeks off of work. I could have gone back within 5 to 7 days. I get emotional when it changed my life. just wearing sleeveless shirts, being able to dress like everybody else, being able to spend time with my husband and go to the pool and just be active. A lot of people started to talk to me again because I wasn't friendly whenever I was heavier. I was angry, I didn't want to do anything, I was like a hermit. So my responses, I mean, they want to know how I did it, and I'm very open about how I did it. I was like, you know, I had the surgery. I couldn't do it myself. I could not do it without the surgery. Could not have done it.
My patients, since obesity is a systemic disease, when we cure it for them, they get better on so many fronts. It's nice to see how they're doing afterwards. They really are changed people.
Tiku broke his jaw growing up and his teeth never lined up until he met oral surgeon Dr. Paul Metz. To find out more about Tiku's story and other life-changing stories, log on to bestdocsnetwork.com.
I saw the potential in 3D at really taking digital to where we needed it to be, and it really has become what I would call a revolution. And I was very strong in my recommendations to the company that we really focus on looking at this as a screening tool. That's where it was going to make its impact.
2 years ago, I went for my annual mammogram and was in there, and they told me that they were doing a study for the 3D, and they asked me if I'd like to participate, and I said sure. I was already back there and undressed, and it was not a big deal.
She was the second patient in the multi-center trial that we did in 2010, and you had to come and get your standard 2D digital mammogram, which got read separately, interpreted by a different radiologist, and then the 3D exam would be performed separately.
First I got the letter that said that no problem, didn't see anything, you know, come back next year. Then I got the phone call and they said, well, no, we saw something in the 3D. And it turned out that one of the tumors was actually an aggressive, the HER2, had a HER2 marker in it, which is the more aggressive, can be one of the more aggressive cancers.
As we're able to page through the breast a millimeter at a time, we're able to look at areas that we would struggle with before on the 2D mammogram and say, is that something or not something? If you find malignancies less than 10 millimeters in size, the prognosis for the patient is essentially the same as the general population. So most of those people, the vast majority of those people, 98%, are cured.
Obviously somebody up there was looking out for me. I mean, I think it's the greatest thing. I mean, I think it saved my life.
So this woman had received a normal letter for her regular digital mammogram, but on 3D, we were able to find 2 very tiny cancers. That's the value of finding it at this stage, and that's what makes this test the most exciting thing I've seen in my professional career.
Vitamin D deficiency is a very common problem in America. It's not so much our diet, it's just the lack of a lot of sunshine because we've been taught not to get a lot of sunshine anymore. Vitamin D in your body should be somewhere between the number 30 and 100. Now, if you're real low, you need to get that up. Vitamin D can help you have a better immune system function. Also, it prevents heart attacks and strokes. And there's even some evidence that it helps fight off cancer as well as reducing the rates of Alzheimer's disease. Now, if your vitamin D is low, that is less than 30, you want to get it up into the range of 30 to 100, preferably around 50. Now, for most people who are deficient, that's going to take somewhere between 1,000 to 5,000 international units. But you want to be sure you get vitamin D3, not vitamin D2. Get the cheapest vitamin D3 you can find over the counter. Vitamin D3 is absorbed better and utilized better in the body than vitamin D2. So get vitamin D3 and take enough units to get your number up between 30 and 100. Your physician can measure that number now, put you on the right number of international units, and then check it again in about 3 months and see if you're in the right range. So it's not good to get D's in school, but it's very good to get D's in your diet.
My symptoms are, I don't want to walk on the ball of my foot. It shoots sharp pains up my leg. I mean, it feels like a nerve's being pinched off.
Wanda's a patient that presented to my office complaining of shooting pain, down her heel, upper leg, and so immediately I started thinking maybe there's a possibility of a nerve, compression.
I told him my symptoms. He suspected what it was. He wheeled in a little mini ultrasound machine, did it right there on the spot, and diagnosed the problem. And we set up surgery because I had already tried other treatments with other doctors and it didn't work, and we were done.
This is your ankle joint, and you have a major nerve that courses through here. There's a natural tunnel. It's called your tarsal tunnel. What happens is the tunnels get real tight and they clamp on the nerve, are the protective covering, which we call the flexor reticulum. The nerve tends to get stuck underneath it. So what happens is when the nerve gets compressed, it's extremely painful.
What he's trying to do is avoid that numbness, and for most people it works. You basically take what's pinching the nerve off away, and you make room for it, and life goes on.
And the advantage of this is it's not a surgery where you're really held up for a while, where you have to, stay at home and you can't put weight, because I want the patient walking as soon as they can, because I don't want those tunnels to tighten up or to close up. So I want to make sure the nerves can glide. Wanda had tarsal tunnel surgery. She comes back to the office 3 to 5 days later, and just dressing change. No need for x-rays because we're not doing any bone work, which is great too, because if you're not doing bone work, it's not necessarily as painful. There's less swelling. And so 2 weeks later, sutures are out and she's walking on her own.
I'm very happy. I've actually recommended him in all my friends that have gone to him, and they've had more extensive things done to them where, you're reattaching muscles and putting in screws, really crazy stuff. They also think he's awesome.
The side effect that one has from nerve decompression is not pain, it's lack of sensation, it's numbness. And that's temporary because with time they regain their sensation, but it's a really easy recovery and it provides immediate relief.
When you talk about Ceci, she's talking about issues that pretty much any lady who has had several children will talk about, that they just feel that their stomach never quite went back to the way it was before.
I've been active all my life, and in sports throughout high school, my collegiate years, ran track and field and competed in Miss Fitness USA competitions and had a flat stomach for pretty much most of my life. I had 3 beautiful girls, but with the pregnancies, I had 3 C-sections also. And so having the flat stomach before and not able to achieve that afterward was kind of like, a punch in the stomach, so to speak. And I wanted to do something about it.
And you can do all the exercise in the world, you can diet all you want, and you will still find ladies that still say, I just bulge a little bit more than I remember. And why do they? It's because that tissue, that connective tissue there of the stomach, has basically been kind of stretched out like a balloon that's been overinflated, a rubber band that's been pulled too far, and it never will snap back to the way it was before.
I need to start, doing for me now, just getting my body back to the way I wanted it to be, and I really didn't think of plastic surgery, but I did my research and I'm glad I did. I'm just so happy that I did.
You see all the effort you're putting in, you want to see the results, and that's frustrating for any individual to do something and not see the results from it, and that's where she was. But then after the surgery, once you get that tightness back and fix the tissues that were stretched out by pregnancy, then it just adds that whole measure back to exercise that she wanted to have from before.
The flat stomach, it is there. We've gone on 2 cruises already, and I've been in my bikini. I haven't been able to do that in a long time, since before my competition, so that was back in 1999, so I hadn't been able to do that in a while. I'm full force working out, doing ab exercises, working out with my husband, and running, jogging, just doing all the things that I used to do, but now I can show it off and I can wear a half tank top, to work out in, it's like things I didn't think I would be able to do again, thanks to Dr. Bancroft, yeah.
All right, don't forget, for more information on any of the doctors you've seen on today's show, you have to head to the website. That's bestdocsnetwork.com, bestdocsnetwork.com.
That's right, and now it's time to head to our next doctor, ENT, Dr. James Ludwick.
Well, Keith came to see me because he was having recurring sinus infections and facial pressure and ugly drainage out of his nose, and he seemed like he was sick all the time.
And like I said, I travel to China an awful lot, and it's a pretty exhausting trip, and I would inevitably end up getting sick, and and it would last for 2 or 3 weeks. And
we're designed to breathe through our nose, right? We're not designed to breathe through our mouth. Air comes in the nose, it gets warmed, humidified, cleaned. That's why if you breathe through your mouth, 2 or 3 breaths, you already feel it desiccating, getting all dry in there, and you want to breathe through your nose. So I always tell patients, you have 2 patients, both have allergies. This guy can breathe through his nose and this guy can't. Who's happier? Everybody knows the answer. Anyway, so he was having these complaints, so I looked at his nose. He supposedly had a previous septal surgery, but he still had a bad septum, and he supposedly had previous sinus surgery, but so just because you've had sinus surgery doesn't mean you've had all of your sinuses addressed, if indeed they all needed to be addressed.
A month later, I was feeling better than ever, and actually took out a bunch of polyps from my nasal cavity up in my forehead. That I used to get sick anytime that I was extremely exhausted, and I travel a lot, and every time I would get sick. And since then, I hadn't been sick.
What I find is patients who've had sinus surgery and they've had like some miserable post-op experience, and then on top of that, it didn't even work and they're still sick. They're like, well, I've already tried that, it didn't work, and it was miserable recovery, and I'm not doing it again. And so they live like the rest of their life with recurring sinus infections and chronic congestion.
All the technology he's got that he can show you, look, this is what happens, and it's kind of interactive type deal. And I mean, I can't speak for somebody else with similar issues and how bad their situation is, but I mean, it worked for me.
And I love those patients when they finally come in to see me, because I teach them, like, look, you've had surgery, but this is what was done. And this is where you are, and if we fix this area, you won't be like that. Keith is just that patient, who's gone through it once with a bad outcome, and now, is very happy.
My name is Rashid Rashid. I have an MD and a PhD. I was born and raised in Puerto Rico. Went on to medical school at Loyola University. I did a combined degree program. I did an MD and a PhD at the same time. So it took me 7 years. Normally, if I had done them separately, it would have been a 10-year program. I've always had a very strong interest in research. I really like to understand where the information we use comes from, why we use the information we use, and why things are happening. I trained at MD Anderson, so when I did my training there, I had the opportunity to do rotations in clinics around the country, including at UCSF and other clinics that specialize in hair loss. So it always fascinated me to be in this area where few people were in, and where it really matters to people. It really matters to people that they're losing their hair. And yeah, we have over almost 70 peer-reviewed papers, all in journals that have very strict criteria for publications, including national journals like academy journals and our specialties in dermatology and medicine, trauma, across the board. Our hair loss papers mostly focused on things like other peripheral associations with hair loss, like vitamin D deficiency. We have a paper that is often cited about vitamin D deficiency in hair loss. We do a regular daily auditing of the peer-reviewed research, and we regularly review and examine what's out there. We consolidate that, we provide that in an updated blog we have online, and it basically summarizes all the main new research ideas that are coming into place or they're just being developed by scientists and physicians around the world. So our method is called the follicular unit extraction. That's been around for a few years. It used to be done manually, hair by hair. It would take a long time. Now we have different devices and machines that have sped up the process, so we can do larger cases in less time, and the price is also more acceptable to people than it used to be. You would get more hairs, get back to work, and a lot less downtime. And the healing is very, very quick.
I think there's a lot of confusion now about exactly what an allergist is, because a lot of people do allergy testing that are not board certified in allergy and immunology. So what we see actually in this practice is not always allergy, but people come to us because they think that it might be allergy.
According to Dr. Dickens, allergies really come down to having a problem with the immune system.
allergy is really just an abnormal response of the immune system that some people have, and they react to things in the environment that really aren't harmful, but if you happen to have an abnormal antibody called an IgE antibody, then you start to react to things and the response actually harms you more than it harms that ragweed pollen.
Many know living in Houston can cause allergy problems. The reason?
I would say because we're very humid and moist and warm, we see a lot of mold problems here, and people can develop not only allergies, but they can develop a chronic allergic reaction to that in their nose and wind up having polyps and then develop asthma, those kind of problems. So we see a lot of mold because it's always either heavy or extremely heavy. Dust mites because the environment is again very moist and warm, and they can get down in the carpet and into your homes.
When it comes to helping people with allergies, Dr. Dickens' Allergy Clinic does it in a unique and special way.
We try to have the nice art in the office that they feel very comfortable when they're here, that it's not sterile, that the staff knows them well over the years, and we try to spend a lot of time knowing their particular story and how they would respond best. So I really think it takes a village in a way, and I have a very nice village here. Wonderful staff, very well trained to be able to recognize different kinds of allergic emergencies and treat them quickly and call the doctor when necessary and really just make the patients feel very secure. That's what we try to do.
Officer Wayne Schultz weighed an unhealthy 554 pounds until he met Dr. Robert Marvin. To find out more on Wayne's story and other life-changing stories, log on to bestdocsnetwork.com.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is, so that we can position implants within that bone and avoid the need for sinus grafting, and then subsequently lower his overall costs significantly, as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling, and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
Our case example is Barbara, who was in her late 60s, who we operated on several months ago. And she was interested in removing some extra eyelid skin in her lower eyelid.
I've always wanted to have my eyes done, and he laid it all out. He explained to me what he was going to do.
Consider the eyelid and the forehead as one aesthetic unit. The cheek The neck and the jowl area we consider as another aesthetic unit. We do combine the surgeries, however there are people who are just interested in having their face done or their eyelid done, but sometimes if you just do the eyelid and not the brow, they still have that hooded appearance.
He put me at ease, and I knew that he was going to do a good job, and he did.
She really wasn't too interested in actually in the upper eyelid being done, and was mainly so concerned about her lower lid, but we showed her some pictures before and after of people who had it done, and after seeing that she agreed to have her upper eyelids done, and I was happy she decided to do that.
And after about 4 weeks, all the bruising was gone, most of the swelling was gone, and I was shocked at how great I looked. I really was. I hadn't expected the change to be so great, and I'm just really overwhelmed at how different I look.
It doesn't look like she's had surgery, which is what we're basically trying to achieve, is a natural look, nothing stylized. But she can recognize it, and that's the most important thing.
And I met a lady in the bathroom who works down the hall, and she said, "You look great. What did you do? What's different about you?" And I started laughing, and I said, "Oh, I got a new hairdo." I mean, I didn't tell her, but it's amazing, and it's happened 3 times. And he put me so at ease. That's really what helped me make my decision that I was going to go ahead and do my eyes. Well, this has really made me feel better about myself. And so I really am so glad I did it.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, ear headaches, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really, without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway, it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage, and we open up, you inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have cold all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that have helped change people's lives.
And for more information on any of these doctors, head to the websites, thebestdocsnetwork.com. Also, if you have a question or comment for us, we love to hear from you. Send us an email at info@bestdocsnetwork.com. So long, everyone. We will see you next week.